Hi there, mom to be. Hope you're well. Welcome to this channel. The channel is about motherhood and parenting tips. If you're new here, you're so much welcome. My name is Vera. Here we share knowledge on how to raise a happy and a healthy baby. And so today we want to talk about danger signs during pregnancy. It is important that every pregnant woman is aware of the danger signs during pregnancy so that you know when you're supposed to seek medical help. Make sure you watch this video until the end so that you learn about all the danger signs that I'm going to share with you. The first danger sign we are going to talk about is vaginal bleeding. Vaginal bleeding during pregnancy can be caused by various reasons. The reasons may be ectopic pregnancy, implantation bleeding, miscarriage, placenta previa. There are so many reasons that may cause vaginal bleeding. And so during pregnancy, whenever you experience vaginal bleeding, blood is enough to fill a panty liner. Please seek medical help. Go to the hospital and confirm with your gynecologist or doctor whether the bleeding is okay. It might be implantation bleeding, which is normal during early pregnancy. We had talked about implantation bleeding in the previous video. You can go and check it out so that you know how you experience it, the amount. And so vaginal bleeding during pregnancy is a danger sign. You need to go to the hospital to confirm with your doctor or a gynecologist if it is okay or it is something else. The other danger sign we are going to talk about is abdominal pain. Whenever you experience abdominal pain during pregnancy, maybe in the end first trimester, second trimester, or third trimester, make sure you go to the hospital. And if it is pain that is not going away and it is increasing, make sure you rush to the hospital. And especially if it is during early pregnancy and you are feeling pain on one side of your stomach, that might be a sign of ectopic pregnancy. Make sure you go to the hospital so that you are checked by your doctor or gynecologist and treated as per your condition. The other sign we are going to talk about is swollen feet, face, and hands during pregnancy. A bit of swelling is expected during pregnancy, especially on the feet. But if you experience swelling on your face and hands and feet included, make sure you go to the hospital. That might be a sign of high blood pressure. The other sign we are going to talk about is severe headache. Severe or persistent headache. You might experience a bit of headache during pregnancy, but the headache should be going away after rest. If you experience headache that does not go away after rest, go to the hospital. It could be a sign of high blood pressure, especially if the headache is accompanied with blurred vision and dizziness. Make sure you go to the hospital for checkup. The other sign we are going to talk about is high body temperature. A mild increase in body temperature is normal during pregnancy, but if you're experiencing high body temperature of 38 or more, most of the time, that could be a sign of infection. Make sure you go to the hospital so that you get checked up and treated as soon as possible. The other danger sign during pregnancy is when your water breaks. If this happens, you experience a watery fluid that will leak from your vagina. If you experience such symptom and your pregnancy is below 37 weeks, make sure you go to the hospital for checkup. The other sign we are going to talk about is reduced or no fetal movement. Your baby will be moving in your belly at around second trimester. And so if you experience your baby moving less than usual movement, go to the hospital so that your baby is checked whether he or she is okay. The other sign we're going to talk about is difficulty in breathing. Difficulty in breathing is common, especially during the 3rd trimester. This is because the uterus is growing and is pushing other organs upwards. If you experience difficulty in breathing and accompanied by chest pain or coughing, make sure you go to the hospital for checkup so that your doctor may know what is causing it and you get immediate medical attention. The other sign we are going to talk about is pale. When you are pale, that is when your palms appear whitish and your conjunctiva appears whitish. That is a sign of reduced blood flow in your body. You need to go to the hospital so that you're recommended some medicine that will increase your blood, or if it can be boosted by food. You are told the food that you need to eat so that your blood may increase in your body. We are going to talk about convulsions. Whenever you convulse during pregnancy, do not ignore. Go to the hospital. That could be a sign of high blood pressure. Make sure you visit the hospital so that they check your blood pressure, and you are attended to as per the findings. I hope you've learned something from the danger signs that I've shared. You know what to do when you experience the danger signs that I've talked about. Make sure you rush to the hospital. Don't hesitate. It's better to go there and be told you are okay than just staying at home. Whenever you experience any of the signs I've talked about in the video, make sure you rush to the hospital so that you can be checked and attended to. Thank you so much for watching the video until the end. I hope you've learned from the video. If you've learned something, give it a like so that YouTube can recommend it to more people so that more people can learn. And if you've not subscribed yet to the channel, make sure you subscribe so that you learn more about motherhood and pregnancy. Thank you so much for being here. Thank you for watching. Stay safe and see you in the next one.